All right, we are live. Welcome to another episode of Divine Farmer Health Podcast. I'm Jimmy Yen, the Acu Sensei, and we've got Chris McKee, the nutritionist. And every week we're just talking about different topics of how to improve your quality of life with basically daily, or I would say practical lifestyle habit changes, habit upgrades, things that you can do at home. And so we're here to just dispense information, also have a discussion. And so we don't know everything, and we don't claim to know everything, but we share what we know, what we find out, and what has worked. And again, medical disclaimer, we are not medical doctors, so we are not giving you medical advice. This is purely a discussion. So, but you can ask your questions, and when we get some time, we can answer those as well. So, Chris, what is the topic for today?
Our topic today is inflammation. And I thought we'd do this because of our Q&A we did on Monday. And we had so many questions on our Q&A, and so many of them, when you got down to it, was, well, we talk about root cause, right? Inflammation. And so I thought we'd dive into it a little bit because I don't really think people understand what inflammation is, how they get it, and we always get asked questions on what can we do about it. So it's a big topic. And so I thought we'd first talk about what it is. And most people don't realize, I think we know this intuitively, but we don't realize that it's an immune response. So when we feel inflammation in the body, like a joint pain or gut issues or migraine or whatever, I don't think we go, oh, that's my immune system responding to something. It doesn't seem to, we don't connect the two. But if you've ever cut yourself, like a finger, let's say you cut your finger, right? It's going to get red, it's going to get swollen, and it's going to be inflamed. And that is your immune system trying to heal your finger. So it's doing its job, and we want it to do that. We want it to do its job. The problem is when it's chronic and it's all the time. So we have an innate immune system. That's an immune system that is the first line of defense. It's going to be the first line of defense if a virus comes in, a pathogen comes in. Let's say maybe you eat a food that your body doesn't like. Your innate immune system is going to respond. And so that's a good thing. We want that to
Mm-hmm.
happen. And if it can handle the situation, it's good. It's okay. If it can't, it sends out for the armies, right? And then that's the adaptive immune system, your T cells and your B cells and all these different things that show up on the scene. And they are going to be a little bit heavier of a hammer in attacking something. I'll never forget the first time I saw this on, and don't laugh because you were probably, I don't know if you were born yet, Jimmy. You might have been 2 or 3. But the first time I ever saw this was on a slideshow. So back in the day when we had slide projectors with the carousels, right? There was no computers, there was no internet, nothing like that. But it was a clinical nutritionist. I went to a talk, and he was showing a picture of the immune system attacking I think it was a virus. And it was so profound to me to see that immune cell. It just kind of slobbered all over this virus. So it's amazing. It just attacked it, right? And it just went after it. And we want the body to do that, absolutely. But the problem is when it's chronic. What if that immune system is attacking your own tissue like that? We don't want that, right? So inflammation is an immune response, and I think that's the first thing that we want to help people to understand. We want our immune system to work, but we don't want it chronically on all the time. So do you have any comments on that, Jimmy?
Yeah. And so first, I'm actually older than most people think. So I remember in school, it's like, I'm not sure if this is what you're talking about in regards to slides. There was a carousel, and they would put little individual slides, and then
Yeah,
it would project into the, into the, yeah.
that's what I'm talking
So,
about. Yeah.
yeah. So yeah,
Yeah.
I was definitely doing that. So for those of y'all who don't know, I'm actually 46, about to turn 47.
All right. There.
So a lot of people say I look a lot younger than what I really am. But Yes, inflammation. So I like to break down inflammation very simple. Inflammation is a necessity to healing. You need inflammation. And but there's I would say break it down to two main categories of inflammation. One is acute inflammation and one is chronic inflammation. So the acute inflammation is like what Chris was you're talking about when you cut a finger or you twist your ankle, you want acute inflammation. Because what does that really mean? That means your body's sending all the troops to that area to heal it, to fight. You know, if there's a virus, bacteria, or you want your troops to go there and fight and kill everybody. You know, kill the bad guys, and then eventually heal that area. That's acute inflammation. You want that to happen. If you don't have that, you're gonna die. Okay, so
Yeah.
you're gonna bleed to death, right? And now to the immune system. The immune system, I love to use the analogy of just like the this in your army, the military. You're going to have different weapons in your immune system and different weapons for your military. And so, for example, you've got the traditional, or I say the tank, the bazooka that just blows everything away. It doesn't really pick. It's just like one area is going to blow everything. It doesn't matter if it's foreign or if it's your own body, right? That's like the bazooka approach. Then you've got like snipers that can really pinpoint exactly the enemy, the specific enemy, and take those out. And so a lot of our immune, I would say, acute inflammation goes with the bazooka attack. It's like you just blow, or shotgun. People say shotgun attack. Shotgun, you're not really aiming, you just point in the one direction and it just sprays, right? And a lot of times that kills your own cells too, right?
Yeah.
So
Yeah.
that's what I think about when we're talking about immune system and inflammation.
Yeah, yeah. So like I said, we had a lot of questions on Monday about different disorders or diseases. People were naming their disease, name it and claim it. And so, we had to definitely have disclaimers and say, we're not doctors and we're not, if you've got a diagnosis, but what we were asked questions about, or a lot of it was underlying from chronic inflammation. So I'm just going to read you a huge list. And it's just because most people, again, I think they know this, but they don't really connect the dots that this is your immune system attacking your body. So in the gut is a big one, right? We started with a lot of questions about GERD and acid reflux and stuff like that. Of course, the food plays a big role in that, and we'll get into that. Highly, foods that you're not your body's reacting to. But IBS, irritable bowel, diverticulitis, celiac, constipation, diarrhea, GERD, all those things, gut issues, lots of inflammation in the gut. We see this a lot with people. And then skin. So I always tell my clients with skin disorders, you got to go back to the gut, because a lot of times it's connected to the gut. But you see eczema and psoriasis and acne and rashes and fungus and things like that. And then allergies. So it could be airborne allergies, it could be food allergies, those types of things. Again, I think we all, if you have an allergy of airborne allergy, like we're going to be heading into cedar season in Texas, and everybody's
Mhm.
got runny eyes and lots of inflammation going on there with the allergies. And then you have joint and tissue inflammation. So that's where we really feel it in our joints, and if we're moving around our neck or sore or whatever like that. But then we get into the autoimmune conditions. So those are super serious, rheumatoid arthritis and lupus and Crohn's and inflammatory bowel disease and, Hashimoto's, you see a lot of Hashimoto's. So there are 100 different autoimmune diseases now. 100 different autoimmune diseases. Is that wild? And there's 50 million Americans with one or more autoimmune disease. 50 million. So something's wrong here. Something's definitely out of whack. And, I see it because I've been in this field for so long. Like I said, when I went to school, it was, slideshows and things like that. We didn't see this, 20 years ago, I didn't see this like I
Mhm.
see it now. And so we'll talk a little bit about why that might be. But any thoughts on this whole autoimmune and all the issues correlated with inflammation? You probably see it
Well,
in your clinic, right?
yeah, we see so much autoimmune in our clinic. It's like, I mean, the statistics that you just quoted, that's just crazy.
Yeah, wow.
100 million different types of autoimmune, and 50 million people are getting. So let's think about, I mean, for me, I like to think about things logically. Yes, medicine is advancing here in the US. And but if you can view it from one point. If it's advancing, why are we having so many more of these autoimmune problems, right? You can say on one hand, oh, it's because technology now is able to identify these autoimmune. Yes, that also comes into play, but people are getting sicker. And we have seen that definitely in the past since post-COVID. COVID
Mm,
really brought out how sick we were as
yeah,
as a nation and as a community. I mean, it's just because people were less active, so all the problems, came out. And so the it, if the solutions, technology and the solutions, the new discoveries, medical discoveries, were really fixing the problem, we should have less autoimmune, not more, right? If the food, was really healthy for us, we should have less autoimmune, not more. We have so much more like Crohn's disease, gluten sensitivity, more than usual, right? And it's getting worse every year. So our food's getting worse, our health is getting worse. If you are tired, if you haven't noticed that just within your own family, it's time to pay attention because what we are doing isn't working. It's like Einstein said, if you keep doing the same thing and expecting a different result, we're literally clinically insane. And
yeah,
so that's what's happening in our society is we keep on doing the same thing. Okay, yeah, and a lot of things, not to get off too much off topic, is you're trying to, you know, listen to someone who hasn't, I would say, doesn't have the skill set or I would say the results to tell you what to do with your health. And I'm talking about insurance. People are looking to insurance to solve their health problems. Insurance is not solving your health problem. Insurance wants you to stay sick so that you can continue to pay for more health insurance, more medications. But that's a whole another topic. So just think about logically, simply. If food was better, medicine was better, why do we have a extreme growth of autoimmune problems?
yeah. That's a really good question to ask. Do you still do in your clinic? I know when we came there, you did with my husband, you did a thermography, a whole body
Hmm.
thermography, looking for
Yes,
inflammation. And that was fascinating to me because I've done thermography instead of mammography for breast,
mhm,
but which will show if you have a tumor, it'll show it really, really early, and it shows up as heat because it's got to be fed. But you did the whole body, and
mhm.
that must be amazing to look at people's bodies with that thermography machine and see the inflammation in the body.
Oh yeah. So the thermography, for those of you who are not familiar with it, it doesn't detect all inflammation, but it does give one of the pieces of the puzzle, right? And we do it for the whole body because our bodies naturally emit infrared heat, and that heat is generated through your blood circulation. So areas where you have more inflammation, it's going to show up bright red hot. And areas where the opposite extreme, where there's like minimal circulation, it's going to show up black cold. And so
Mm,
we use that to monitor the treatments for our patients. And yes, I mean, every time a patient improves symptomatically, we can also see their thermography scan improve as well. Because guess
yeah.
what? Circulation's improving.
Yeah, and inflammation is going down.
Exactly. Yeah.
Yeah, so I thought that was really, really fascinating. So the big question is why? Like you said, if we're having all these advances in medicine and everything, why are we seeing more and more and more of not only just autoimmune, but I think gut issues are huge, like you said, with gluten
Hmm.
intolerance and all the itises, colitis and diverticulitis, and anything with itis on the end means inflammation. So,
Hmm.
you start to look at uh, that, and you start to see a ton of that. And of course, we are siloed in Western medicines with doctors. So you have your, you go to your gastroenterologist, and then you go to your immunologist, and then you go to your endocrinologist, and you have all these different silos, and you may have things that are totally connected, but one doctor isn't saying, well, you should do this. If you're going to see a gastroenterologist, he's not going to talk about your thyroid, right? So it's just sad because people go from doctor to doctor to doctor looking for answers when none of them are communicating with each other, and they aren't looking at the whole picture. So I think that's where you and I really like to help people see the interconnectedness of all this stuff. So what is changed? So what has changed? I know for me, in almost 30 years of being in the field of nutrition, what has changed? Well, I can tell you the stress level of people has changed tremendously. I see this with my clients when I do an intake. I'm always talking about where's your stress coming from and what level. One, on a scale of 1 to 10, 10 you're pulling your hair out, 1 you're chilling on the couch. Where are you at? Almost everyone is 7, 8, 9. Their stress levels are really high. And again, I don't know that we correlate stress with inflammation, but if you think about, someone can get an ulcer, from stress. So your mind can definitely affect your body, and it definitely sends off. We've talked about this a little bit before. Adrenal glands just are in hyper overdrive, and you're in that sympathetic nervous system state, which is fight or flight, which means the body's not going to focus on healing or repair or digestion or any of that stuff. It's waiting for the bear to jump out of the woods at you. So it's on heightened alert all the time. So I think that's a really big thing. Stress is a big thing. The food
Yeah,
is
the
absolutely,
diagnosis, just
yeah,
jumping really quick, they
yeah.
actually have a diagnosis, stress ulcer.
Oh, there you go. Yeah, yeah. So we know the brain can affect the gut, and the brain can affect the body, and that's inflammation. And making an ulcer is a huge amount of inflammation. And then the food is massively changed. So when I was going to school and my kids were in middle school, they were coming out of elementary going into middle school when I went to school. And they were there was a fast food restaurant here or there in the town we lived in. We lived in a pretty good sized town, but there wasn't a fast food restaurant on every corner. We rarely ate out as a family. It was like a really big treat to go out to dinner, right? I was fortunate enough to be a stay-at-home mom. I taught aerobics. I taught aerobic dancing. So I was in the fitness industry, but I worked, I did it in the morning, and it was, my kids were in school and stuff. So I was at home. I made dinner every night. And I grew up in a family where my mom was a stay-at-home mom, and we ate dinner every night. And so it was home food, home cooking. That has completely changed. I think the food is just a massive change in the last 20 to 30 years, massive change. And so I think that really has impacted us because we're taking in so many toxins in the food supply. Not only the pesticides and herbicides and things on non-organic, but you're talking food coloring and preservatives and all these new chemicals that we know they put in things like Oreos. So you can't just eat one. Yeah, they want you to eat more. They want you to eat the whole sleeve. You can't stop with just one. The other things, sugar, obviously sugar's come in a massive way. And we talked about this a couple of weeks ago, I think, with the onset of the low fat diet, which started in the 80s, and then they replaced that with carbohydrates and starch and sugars, and then boom, we started to see this diabetes epidemic. So that whole shift from eating fat to eating sugar and carbs, super inflammatory. That whole food category is super inflammatory. And then, of course, if you're on pharmaceuticals are not innate. They may take away the heartburn, but they're doing other things. And I can't wait to have some of you take our courses, because I dive into, stomach digestion and what happens when you take these antacids, and it's the downstream effect of every organ downstream. is unbelievable. And we talked about this. I think I talked about this on when you were gone I did a stomach podcast about the millions of people on antacids. So, pharmaceuticals make a big difference and a big role in how our bodies are responding. We're shifting things chemically with pharmaceutical. So those are just some of my top things. Do you have anything you want to add to that?
Well, I would say, what can y'all do? So what can we do for inflammation? I mean, we let's just, break this down very simple. Stress is the cause of inflammation. And this is something that, we will dive deep into we have a 4R weight loss protocol that we're running right now. And so, we address what's the true root cause. The true root cause is not your hormone imbalance. It's not your enzyme imbalance. Those are not the true root causes. What caused them to be imbalanced in the first place? And this is where we're talking about stress. There's 3 types of stress: physical, chemical, and emotional. And so this sounds so simple, and it is that simple. Health is actually very simple, but it's difficult to do. Why? Because it takes time and commitment. That's why it's hard to maintain your health. It's so much easier just to take a pill. It takes 1 second to pop a pill. But let's look at the result of when you pop a pill. When you pop a pill, you're suppressing, right? So let's talk about, autoimmune. How do they start? When you remember, inflammation is a good response from your body. But the problem is when that inflammation stays, right, and it doesn't eliminate it, it doesn't go away. So it goes from acute to chronic inflammation. So using the analogy of the troops, you injure you twist your ankle. All the troops are going to your ankle. They swell up. It swells up. Your troops are there, and it fights any type of infection, and it mends everything. But what is chronic? That's acute inflammation. Chronic inflammation is when those troops don't go back home. They stay in that ankle, right? So guess what? If they stay in that ankle, it's still going to stay swollen. And if you have too many troops, let's say that area, your ankle, should only have 5 troops. But because you've injured it, now it has 1,000,000 troops. So imagine 1,000,000 troops in your ankle. They need to eat, they need to poop, they need to eliminate, and they're just constantly eliminating. They didn't go home. They're just staying there, and they're pooping every day. So guess what? It's accumulating more toxins. So now it's your troops actually are creating damage in your ankle. So your brain's like, oh no, my ankle's still damaged. So now your brain's going to send more troops, and it's going to attack your own troops. That's how autoimmune starts, right?
Yeah.
And so that, if we just think about that, by suppressing, see, when you take a medication, when you take something that suppresses your brain, it's like you're trying to tell the brain, don't send more troops, right? Or don't heal that area. You're not solving the problem, right? So by suppressing, no, we're not saying don't take your medications. That is not what we're saying. We're saying if you want to fix chronic problems, you got to address the inflammation. So to address the inflammation, you got to look at the root cause. What caused the inflammation in the first place? When you twist your ankle, that's a physical stress. When you eat a bunch of Oreos, that's a chemical stress. When you take medications for 10 years, that's a chemical stress. You know it. If you've been taking one medication for 10 years, you probably had to take 2, 3, 4, 5 to address the side effects of the first medication. So what do? You start from the basics. It's not, you don't go and get surgery and you start removing organs. You weren't born with too many organs. God gave you just the right enough organs so you can function. So how do you fix all this? It takes time, takes commitment, which most people don't want to do, and that's why it's so difficult. But it's actually very simple. You focus on the 3 stresses: physical, chemical, emotional. Again, we're not going to have time to go deep into that today. We can do it on a later podcast if that's what you want. But please let us know what you want us to discuss on these podcasts, because we want to bring value to you. We want to address the topics that you want to know about. So email us, support@divinefarmerhealth.com, sorry. Or mention it in in our feed.
Yeah. So you're right. It's easy, but it's hard because it's lifestyle change, and lifestyle change has to be the hardest thing for people to do. And they get in a pattern, and that's it. They go, and because their life is stressful, right? I hear this all the time. My life is so stressful. I don't have time to exercise. I don't have time to cook food from scratch. So there has to be, if you, especially with autoimmune, you have to make some major lifestyle changes for sure. And we're going to put in the feed, we're going to put a link for an anti-inflammatory diet, so you guys have an idea what that looks like. So we want to give you that today. And, there's a lot of areas you can work on. You can work on toxic stuff coming in from your environment, right? We've talked about this before with the scents on all the stuff that, the dryer sheets and the plug-ins on the wall and all these scents that you have in your house. Start taking all those scents out. Talk about, those, you're breathing those in, and guess what? Your body is going, this is a foreign pathogen. I need to attack this. So those simple things like that, you can start to get rid of some of these cleaning products that are so toxic. Every time you clean your bathroom, you're inhaling all this stuff and your body's going, the food is a huge part of that. And we'll definitely give you that. And then the stress, Jimmy does some great QRA, quick release acupressure videos on stress. And then I do talk about breathing techniques for lowering stress. So there's a lot of things you can do for the stress. If you can't immediately get out of your stressful environment, like you hate your job or your boss hates you or something like that, but there are some things you can do to help that nervous system to get out of that sympathetic nervous system state and into a parasympathetic state. So there's a lot of things we can do. And the food is a really foundational thing. I think this is starting with food. If you could just start with baby steps, if there's something that that you can't stay away from in your house, like potato chips or something, get them out of the house, remove the enemy, get them out so you're not tempted. I think we have we got like 4 minutes left. I think we've got some questions here in our chat.
That was a specific element. I addressed that
Oh,
one.
okay.
Yeah, but I'll add to the so stress. Everybody's like, yeah, I know stress is killing my life. It's killing. Yes, it is true. I mean, it is. Everybody knows it, but not everybody addresses it. Now,
Mhm.
stress is not just emotional stress. It's not just like you being pissed off, or you hate your job, or you can't stand your spouse, or it's not. That's not just the only. That's one type of stress. That's the emotional stress. But here's the thing: what people don't realize, okay, is you go through emotional stress like anxiety, depression, right? Those emotional stress. It is because of a physical problem too. I like to
Mhm.
say, your physiology affects your psychology. So your
Mhm.
physical body, how it's functioning, will either make you more agitated or more calm. It will either give you a lot of energy or drain your energy. It will make you super depressed or it will make you happy. That is your physical affects your mental. And you can flip that also. Your psychology also affects your physiology. What you think in your brain absolutely affects physically your body. Because what controls your body is your brain. Your brain controls everything. It is the CPU, the central processing unit. It controls everything in your body, which means it controls which chemicals are being released. Your brain tells your body and your organs which chemicals to release, which neurotransmitters to release, which hormones to release, basically what messages to release. What is the chain? Is like the president. Your CPU is your president. The president dictates all the orders, and then the team below executes it. Well, your brain sends the message, the orders, and the rest of your body's organs, they execute them. So if your brain has the wrong thinking, if you're thinking negative all the time, guess what's going to happen? Your brain's going to send negative messages all the way down your body. It's going to make you anxious, tired. It's going to give you migraines, pain, and so forth.
Yeah, huge connection. And the gut, they're calling the gut the second brain now. And the
Yeah.
communication between the gut and the brain is huge. So the question we had was about anxiety, and there's a huge connection with anxiety and your gut health. So that would be the first place I would look if someone's struggling with anxiety and panic attacks, is get the gut healed up. That is a huge part. There's a two-way communication going on there all the time. We make about 70% of our serotonin in our gut. That's something that no one thought about, when they started prescribing all these antidepressants. They're working on the brain chemical, when in reality, most of it's coming from the gut. So there's a huge connection. So yeah, for sure. The stressors are everywhere and they're coming at us from every place. So we have to pick, baby steps, figure out, honestly, I will say this, and it's hard for people to hear. It's easier to go 100% all in and just go for it and do it versus, okay, I'm going to work on one thing for the next month. Because we have a tendency to slide back into our old habits so easily. But if you talk to you talk to athletes who decide they're going to go for something, like they're going to go for a race or they're going to do whatever, they are all in. I mean, like everything is focused. And it's to me, it's easier to just say, I'm going all in, and everything else, all these other distractions, I'm just, here's my focus. And just really start to experience what that feels like, to take care of some of these things with the stress from the environment, the stress from your food, the stress from your emotional state. Take those tools and start implementing them in a way that you can see the difference really quickly. Sometimes it's really quick, right? Within 4 or 5 days, you start to see some really significant shifts in the body when you're 100% all in. So to me, 100% is easier than 99%.
Yeah.
Whenever I've done something major in my life, it's like, okay, I'm all in, and my focus is completely here, and all the other distractions just have to fade away.
Yeah, absolutely. So we're gonna wrap this. I'm gonna wrap this up. We're over time. So just for those of y'all who are interested and getting rid of decreasing your inflammation, which can cause weight gain. We are running, we have a program right now. So 4R, it's part of our 4R protocol, weight loss protocol. And we're running phase 1, which is step 1. It's a 10-day detox. You still have time to join in. You still have time to jump in. So we'll put the link below in the comments where you can jump in. And we actually, that's the first step of decreasing inflammation, is to detox. You have to remove in order to add new stuff in, right? So we'll put in the link in below in the comments. All right. So that is it. That is a wrap for today. Thank you for hopping on. And be on the lookout. We're going to do some surveys and some polls to see what y'all want to be hearing about, what y'all want to be discussing about. Because again, we want to provide value to you for this. Whether you join our programs or not, that if you join, great. If you don't, it's okay. We're still going to, provide this free information for you to give you some help. Our program's a difference. It's structured help. Instead of you trying to get free information here, and you try to piece it all together, we've already pieced it together for you. Okay, so that's one of the big difference. So we'll see you next week, same time, same channel. All right, guys.
Bye for now.
Have a great day.